Hello everyone, Dr. Alex Vasquez here, and today's presentation is titled Integrating Functional and Naturopathic Medicine Concepts and Therapeutics into Medical Practice for Common Primary Care and Specialty Conditions. I'll touch upon some key concepts and paradigm shifts in clinical care which I believe have taken place over the last 15 to 20 years. I'll start with an introduction, of course. I'll discuss some of the clinical paradigms, and I'll also contrast those clinical paradigms so you can see the advantages and disadvantages of each of those. Then I'll provide an introduction to a protocol that can be used from a functional medicine and naturopathic medicine model for the understanding, management, and treatment of inflammatory conditions. I'll divide those conditions into metabolic inflammation, allergic inflammation, autoimmune inflammation, and also neuroinflammation, including the concept of the gut-brain axis. I think you'll find this work relevant for your life if you are a clinician, researcher, teacher, or if you simply inhabit and maintain a human body. I think this protocol will show you some of the major checkpoints that we need to attend in order to optimize health and prevent disease. Also, if you have any friends or family who may have any of the conditions I discuss in this presentation, I'm sure you'll find the presentation then all the more relevant. I think most of us are aware that the entire process of medical education, from the education itself to the textbooks to postgraduate education, is highly influenced by the pharmaceutical industry. You can see that discussed here in an editorial published in The Lancet, and I've also provided, of course, additional commentary and details. I would hope that by now most of us are aware that the medical journals are highly controlled and influenced by the pharmaceutical industry as well. And in fact, last year in 2019, I published an editorial on that topic written with Dr. Joe Pizzorno. Because of the heavy-handed influence of the pharmaceutical industry in education and in scientific publications, we of course then see that influence translated into how doctors think and practice clinically. So let's look at some characteristics of the pharmacocentric medical paradigm. First of all, it is disease-centered and drug-centered. If a condition has no drug, it's usually ignored within so-called standardized or so-called conventional medicine. Thirdly, the medical paradigm, as most of us know, is very self-affirming. Drugs, surgery, radiation, and vaccination are the assumed or presumptive solutions to all health problems, regardless of their dangers, costs, inefficacy, or the existence of better options not taught in medical school and residency. Nutrition is belittled categorically, and that belittlement is not based on knowledge, but rather ignorance. I think we also know that the medical profession is also very exclusive in many ways, socially and conceptually. If a better solution is not a drug, then it is usually not considered a realistic solution. Again, nutrition is excluded categorically, even though nutritional therapy has been shown to provide benefit even for purely genetic disorders such as sickle cell anemia. Another aspect of the medical paradigm is that the ends justify the means. So this is what I call illogical proportionality. Serious diseases require serious, that is, expensive and risky treatments. And I think this model of ends justifying the means also accounts for some of the abusiveness that we see in medical education. Also within the medical paradigm is hierarchy of command and thinking, the deference to specialists, which of course sometimes is highly appropriate. However, generally speaking, within medicine, most of the decisions are made by authoritative groups and published in major journals, and so doctors have to comply with the so-called standard of care and so-called approved treatments. So again, medicine is very hierarchical. It is decided upon by authoritative groups, implemented by physicians, and then followed by compliant patients and students. Very little deviation, very little customization, and very little independence of thought. And number 7, finally for this page, the medical paradigm is very fatalistic. When a person has a disease, the disease has the person, and fate is pretty much predictable and certain. So we say, for example, that a person has diabetes, and many articles, even in modern times, have been published saying that diabetes is irreversible and must be managed by drug therapy alone. In contrast, in the naturopathic and functional medicine paradigm, we see that the same diabetes described as irreversible in medical journals is described as curable within other specialty journals, especially within the field of nutrition. So what I'll do on this page is contrast the paradigm of drug medicine, as I might call it here, against functional and naturopathic medicine. So again, the so-called standardized or so-called conventional medicine that most of us learn in medical school is very disease-centered. In contrast, functional medicine and naturopathic medicine is patient-centered. We use nutrition, for example, to change gene expression rather than think our patients have genetic diseases that we can never influence. And I already made brief mention of the condition sickle cell anemia, which we all know is a genetic disease, but with skilled nutritional intervention, we can change gene expression with the clinical use of selected nutritional supplements. Whereas drug-based medicine, or so-called standardized, so-called conventional medicine, is drug-centered and focuses on isolated molecular targets, functional and naturopathic medicine are both nutrition and lifestyle-centered for their interventions. Very nuanced and detailed, and the goal is to improve health and function of the entire organism, not simply impact isolated molecular targets and pathologized pathways. The medical paradigm is very self-affirming. It affirms that its treatments are the best: drugs, surgery, radiation, vaccines. In contrast, in functional and naturopathic medicine, we affirm the patient and we affirm whatever treatment is best for our patient. Whereas drug-based medicine is very self-affirming, in functional and naturopathic medicine, we affirm what is best for our patient and we affirm whatever has the best efficacy. And again, we all know that standardized medicine is very exclusive. It includes its own treatments, but excludes everything else that's outside of medical training. Most obviously, nutritional interventions and nutritional supplementation. In contrast, functional medicine and naturopathic medicine are inclusive of all ideas and interventions that help to improve the health of our patients. In standardized medicine, we think that serious diseases require serious treatments. In functional and naturopathic medicine, we think effective treatment requires the physician's skill and the patient's involvement, but we don't necessarily believe that a serious disease requires serious treatments. That's illogical. That is a clinical logical fallacy. So serious disease requires effective treatment. Serious disease does not require serious, expensive, and risky treatment. In medicine, everything from the way we're trained to the way that we treat patients is based on illogical proportionality, and that is the ends justify the means. In functional and naturopathic medicine, we again believe that effective treatment requires the physician's skill and the patient's involvement. Again, the emphasis is on clinical efficacy and maintaining patient autonomy and respect, rather than thinking that, again, a serious disease has to require a serious, risky, and expensive treatment. Also specific to naturopathic medicine is the concept of the hierarchy of therapeutics. I'll mention that one more time in just a moment. But the hierarchy of therapeutics is a very important concept because what we do in naturopathic medicine is we start with the least invasive intervention possible. Usually that's botanical medicines, nutritional intervention, diet, and lifestyle, before we would think of going on to using drugs or even surgery. And I'm sure, as we all know, in so-called conventional or standardized drug-centered medicine, drugs are primary therapy. So a patient with a health problem can expect to have their nutritional needs ignored and to have drugs prescribed on the first visit when they see a so-called standardized or conventional medical practitioner. Again, the medical paradigm is very fatalistic. People have their diseases, and often they are told they will always have their diseases. In contrast, in naturopathic and functional medicine, we are positivistic rather than fatalistic, and we think we can change these conditions for the better. This is much less medieval thinking and thinking that's more in accord with the Enlightenment and Renaissance. In standardized medicine, again, hierarchical compliance is most important. The doctor complies with the guidelines and the patient complies with the doctor. In functional and naturopathic medicine, accuracy and effectiveness are most important. In so-called conventional or standardized medicine, surrogate markers are commonly considered more important than patient outcomes, whereas in functional and naturopathic medicine, patient outcomes are most important, while we also responsibly manage risk factors, laboratory results, etc. A really good example of where surrogate markers are considered more important than patient outcomes was a recent publication using vitamin C in septic hospitalized patients. The study had two major findings. One is that vitamin C did not change parameters of organ function, and number two is that patient mortality was reduced by approximately 50% in the patients who received vitamin C. The conclusion of the study was that vitamin C was inefficacious because they focused on surrogate markers rather than the successful patient outcome of reducing mortality by 50%. Also, you'll notice that the language of the interventions used in medicine are very different from the language that we use in naturopathic and functional medicine. In so-called conventional or drug-based medicine, we block receptors, we block enzymes, and we interfere with pathways. Whereas in naturopathic and functional medicine, we support processes and we improve physiologic function. So I'll invite you to take a look at this page and contrast so-called standardized or so-called conventional medicine with functional and naturopathic medicine. So a lot of times what we've seen is that as doctors move from a drug-based model to a functional systems-based model, for them they really experience a paradigm shift that changes their entire perception of clinical practice, medical care, and healthcare. So for many people who are new to these concepts, they are now crossing into a new world that focuses more on patient-centered medicine, systems-based medicine, rather than targeting isolated pathways, nutrition and lifestyle-centered interventions that are very nuanced and detailed, patient-affirming instead of drug and disease-affirming, inclusive, which respects interventions based on priority, effectiveness, and synergism, and their ability to address the primary cause or causes of the patient's problem. Effective treatment here requires more physician skill and more patient involvement. For patients, they of course at least have to be willing to change their diet and lifestyle, and for physicians, they actually have to think in more creative ways as they address the underlying cause of the disease, rather than simply managing the disease and manipulating numbers by using drug therapy. So for example, we all know that with patients who have hypertension or diabetes, the goal is to lower their blood pressure and to lower their glucose. So in those situations, we're really just treating the numbers if we approach it from a drug or medical model. Now, we all respect the fact that that's necessary, especially in certain emergency situations in patients who have acute hypertension or acute hyperglycemia. In those situations, yes, we need to get the numbers down and normalized as quickly as possible. However, we need to appreciate that the acute management of those acute crises, such as hypertension and hyperglycemia, needs to be different from the chronic long-term management of those conditions, especially if we're going to actually try to cure the condition rather than medicate it for the duration of the patient's lifetime. So physicians who are beginning to integrate functional and naturopathic medicine into their practices, they have to go through a learning curve, but that learning curve ultimately results in their being more empowered and more creative and effective in their clinical practices. As I mentioned before, the hierarchy of therapeutics from naturopathic medicine encourages us to start with the most benign and patient-empowering interventions, such as diet and lifestyle, before advancing to invasive and expensive drugs and surgery. Functional and naturopathic medicine is much more positive. We believe that we can change these conditions for the better, and we prioritize accuracy and effectiveness as being most important rather than rigid adherence to a therapy-based paradigm. Patient outcomes are most important, while we also responsibly manage risk factors, laboratory results, etc. Again, the language is different. In standardized medicine, we talk about compliance, and the drugs that we use are mostly blockers and inhibitors. We block the formation of cholesterol, we block angiotensin receptors, we block the ACE enzyme, we block HMG-CoA reductase, we block the uptake of neurotransmitters, etc. In contrast, in functional and naturopathic medicine, we try to help systems work better. So we use different language, such as support, improve, nourish. We give people and their bodies what they need to succeed. Nutrition is conceptually different from drug-based medicine. Whereas drugs work on individual pathways, mostly by inhibiting enzymes and blocking receptors, nutritional interventions work on multiple systems by improving enzymatic function and normalizing metabolism and immune function. And on the following page, you can begin to see how some of the major body systems are interconnected and how one might influence the other. So the diagram that you're seeing here, I actually drew back in 2003. It was published in a textbook in 2005 and then later reproduced in a journal article in 2006. This diagram is important conceptually for clinicians and for educating patients to help them appreciate how body systems are interconnected. However, this diagram alone is insufficient for guiding treatment. Clinicians need a structured and memorable strategy. And I'll show you that as I've continued to develop this work over the last at least 10 or 20 years. So again, I see this diagram as being mostly conceptual, but not sufficiently structured to be clinically applicable. So yes, we can learn certain things from this model, but again, in my experience of teaching doctors how to implement functional and naturopathic medicine concepts into their clinical practice, this diagram, great as it might be for kind of a preliminary understanding of how different systems interconnect with each other, this diagram, in my experience, does not serve us very well in terms of clinical applicability and actually implementing clinical therapeutics. So for that reason, over many years, and for example, working with my graduate students, I had to develop another protocol and another model that actually helped them in their clinical practices. And I'll show you that on the next 3 or 4 pages. I'm going to pause just for a moment here to emphasize that we are transitioning now from the introduction and the contrast of different models into a new model that emphasizes clinical applicability. So in order to do that, we need to memorize at least 2 categories of items. Number 1, what are the 4 main types of inflammation? You'll remember that I discussed these on the first page. The 4 main types of sustained or so-called chronic inflammation are metabolic inflammation, allergic inflammation, autoimmune inflammation, and neuroinflammation or brain inflammation. So I want you to start categorizing inflammatory conditions into metabolic, allergic, autoimmune, and neuroinflammation or brain inflammation. Next, I want you to start creating some space to remember the 7 main components of so-called chronic, or what I call sustained inflammation. So again, what are the 4 main categories of inflammatory conditions? Metabolic, allergic, autoimmune, and neuroinflammatory. What are the 7 main components or contributors to chronic inflammation? That's what I'm going to discuss on the next few pages. And as I state here, you cannot necessarily expect to understand, learn, and memorize everything in the first viewing. But by the time you review this material 2 to 3 times, it will start becoming manageable and usable. So let's dive in to those 7 contributors to chronic or sustained systemic inflammation. After many years of teaching functional medicine to postgraduate audiences internationally, plus teaching my graduate students how to organize a large amount of information efficiently so they could quickly transition from familiarity to understanding to memorization to implementation, I developed this functional inflammology protocol and the accompanying acronym that I'll show you in just a moment to accelerate mastery of these concepts for practical use and clinical implementation. Again, the 4 types of inflammation that I'm going to deal with most specifically are metabolic inflammation, allergic inflammation, autoimmune inflammation, and neuroinflammation. Also in this presentation, I'll make a little mention of infectious inflammation, whether that comes from dysbiosis or from viral infections. You'll find this information very applicable to your outpatient management of chronic conditions, and also, but to a lesser extent, applicable to inpatient care, whether that's infectious inflammation, trauma, or more severe and acute systemic inflammatory conditions. In medical training, we are taught that cure is impossible and that we have to manage these conditions long-term with drugs. In functional and naturopathic medicine, we aim for cure. Let's revisit that diagram one more time before we dive into the details. I want you to see how the entire model works together because we're addressing the causes, we're addressing the contributors to chronic sustained inflammation and, as you can see in the diagram, immune activation. So rather than dealing with the long-term management of inflammatory conditions, what we try to do in naturopathic medicine and functional medicine is address the upstream contributors to that systemic inflammation and immune activation so that the inflammatory response is dampened, overall health is improved, and our patients can ultimately and hopefully be liberated from their diseases rather than having to carry those diseases throughout their lifetime. The benefit of this functional inflammology protocol is that it organizes the major causes of inflammation into a mnemonic that helps doctors apply this information clinically in an organized manner. Thereby, this functional inflammology protocol liberates mental and intellectual bandwidth while also liberating faculties for other purposes, such as attention to patient details and needs. At the risk of being redundant, I'll read that one more time. The benefit of the functional inflammology protocol is that it organizes the major causes of inflammation into a mnemonic that helps doctors apply this information in a clinically organized manner. Thereby, the functional medicine inflammology protocol liberates mental and intellectual bandwidth to reduce physician fatigue while also liberating those mental and intellectual and social faculties for other purposes, such as giving more attention to patient details and patient needs. Very briefly now, as we reach the conclusion of this presentation, let's talk about viral infections. Viral infections can be prevented and treated in a logical and structured manner. I published my first article on this in 2014, and more recently in 2019, I published a response on the website of the British Medical Journal, followed by an editorial in the Journal of Orthomolecular Medicine, and I invite you to take a look at all of those articles so that you can gain some new perspective on the pathophysiology of viral infections, but also how we can treat them clinically. Let's take a look at my overall program, which has four main components. First is addressing virus and virus acquisition. Second is impairing viral replication. Third is supporting immune nutrition, both defense and tolerance. And also part number 4 of my strategy is to support cellular and systemic health. We can view these as separate components of viral infection pathophysiology and also treatment, and we can see how these structures overlap. Certain nutrients, for example, affect all of these pathways by inhibiting viral acquisition, inhibiting viral replication, supporting immune function, defense, and tolerance, and also supporting cellular and systemic health. 3 examples include zinc, selenium, and vitamin D, provide benefits in all 4 of these major areas. Other nutrients, such as vitamin A, don't provide benefit in every area, but they are nonetheless very essential. So a basic antiviral protocol must include zinc, selenium, vitamin D, and vitamin A. I discussed this in my 2014 book, Antiviral Strategies and Immune Nutrition, which is now available as a PDF download titled Antiviral Nutrition, and that exact same material is included in the 2016 edition of Inflammation Mastery. So we have now reached the ending and conclusion of this presentation. As I said before, and as I've said for many years to my graduate students, organized and declarative knowledge is the most valuable type of knowledge for intellectual pursuits and practical application. So again, what are the four main types of inflammatory conditions that we see in outpatient clinical care? Metabolic inflammation, allergic inflammation, autoimmune inflammation, and neuroinflammation. What are the seven main components that create chronic or sustained systemic inflammation? So I taught you to use my acronym, which is FIND-SEX, or alternatively FIND-SET. So F stands for food, then infections, nutritional immunomodulation, and dysfunctional metabolism or dysfunctional mitochondria. That's the FIND. The SEX is stress, social inequality, sweat as a metaphor for exercise, sleep deprivation, specialized supplementation, spinal manipulation, and sometimes surgery. The E stands for endocrine imbalances. We look for 3 hormones that are typically elevated and 3 that are typically depressed. And we also make a complete assessment of thyroid function. And finally, the X or the T stands for xenobiotics or toxins. So again, we need to follow the healthiest diet and lifestyle possible with organic and preferably fresh and locally grown food, free of pesticides. Also, as I said at the beginning of this presentation, you cannot necessarily expect to understand, learn, and memorize everything in the first viewing. But by the time you review this material 2 or 3 times, it'll start becoming manageable and more useful for you in your own life, when you're helping friends and family, and obviously when you're working with patients and clients in clinical practice. As Nietzsche said, in order for a particular species to maintain itself and increase its power, its conception of reality must comprehend enough of the calculable and constant for it to base a scheme of behavior on it. In other words, a species grasps a certain amount of reality in order to become master of it, in order to press it into service. And I believe that's what we've accomplished with this protocol that I've now outlined for you. So think of all that you have already learned and all that you have already suffered in your medical training. Now realize that you can add this information atop your previous experience and gain new levels of talent and success. Thank you very much for your attention. I've been your host, Dr. Alex Vasquez, showing you how to integrate functional and naturopathic medicine concepts and therapeutics into medical practice for common primary care and specialty conditions. And again, you can apply this protocol to all conditions of metabolic inflammation, allergic inflammation, autoimmune inflammation, and neuroinflammation or brain inflammation. Thank you very much for your attention.